A soft tissue injury is the damage of muscles, ligaments and tendons throughout the body. Common soft tissue injuries usually occur from a sprain, strain, a one-off blow resulting in a contusion or overuse of a particular part of the body. Soft tissue injuries can result in pain, swelling, bruising and loss of function. Management. Immediately after the injury occurs, one should apply the Price principle to minimize the local tissue damage and reduce inflammation. P. Protection Protection elevation, a Euro unregistered trademark protection. A Euro unregistered trademark protect the individual from further injury by preventing them from moving and keep further hazards away from the individual. A Euro rest. A Euro unregistered trademark rest the individual from any activity that causes pain. If simple movements such as bending, straightening or walking are causing pain, a Euro unregistered trademark rest. A Euro unregistered trademark. A Euro unregistered trademark means immobilizing the injury by splinting or preventing weight bearing with crutches is essential. If walking does not cause any pain, continue to walk for short distances as comfort allows. A Euro unregistered trademark. IC Euro unregistered trademark. During the first 72 hours following an injury, ice can be applied to help minimize pain and control swelling caused by bleeding and fluid loss from the injured tissue. Icing is recommended for 15 minutes every 4 hours to help control the swelling and pain. A Euro compression. A Euro unregistered trademark compression is the application of pressure over the injured area with the use of a bandage, elastic wrap or compression tape. This is to control the initial bleeding of joint or limb tissues, or to reduce residual swelling. It is vital that compression is applied within the first few minutes following the injury to see the benefits. A Euro elevation. A Euro unregistered trademark used in combination with ice and compression. Elevation can also minimize initial tissue bleeding and swelling. Elevate the injured part above the level of the heart as much as possible for the first 72 hours, or longer if the swelling persists. Treatment. If severe pain persists after the first 24 hours, it is recommended that an individual consult with a professional who can make a diagnosis and implement a treatment plan so the patient can return to everyday activities. These are some of the tools that a professional can use to help make a full diagnosis. Nerve conduction studies may also be used to localize nerve dysfunction, assess severity, and help with prognosis. Electrodiagnosis also helps differentiate between myopathy and neuropathy. Ultimately, the best method of imaging soft tissue is magnetic resonance imaging, though it is cost-prohibitive and carries a high false positive rate. References: Flegel, M.J. Sport First Aid, A Coach. A Euro unregistered trademark S Guide to Preventing and Responding to Injuries. Hong Kong, Japan, Human Kinetics. Lindsay, R. Watson, G., Hickmont, D., Broadfoot, A., and Bryn, L. Treat Your Own Strains, Sprains and Bruises. New Zealand, Spinal Publications. Lovering, R.M. Physical Therapy and Related Interventions. In P.M. Shidis, Skeletal Muscle Damage and Repair. United States of America, Human Kinetics. Subotnick, S. Sports and Exercise Injuries. California, United States of America, North Atlantic Books.